Hello everyone, I am Shikaina Aquino Maranga from BSN 111A, and today I am going to perform parenteral drug administration return demonstration using the intradermal, subcutaneous, and intramuscular injections. The procedure that I'm about to perform is the intradermal injection. The intradermal injection is the introduction of a solution by means of syringe and needle into the superficial layer of the skin. In doing so, it is important to observe the rites of drug medication administration to ensure that we are giving the patient the safest care. Prior to the conduct of the procedure, first thing to do is to check the doctor's order on the patient's medication administration record. This is done to identify what kind of drug is to be given to the assigned patient, to identify the drug's name, its dosage, the route of administration, and the time it is to be given. After that, perform hand hygiene to deter the spread of microorganisms and avoid cross-contamination. To prepare the medications, of course, we need to have syringes. I have a tuberculin syringe, which is ideal for skin tests or intradermal injections. I also have an insulin syringe for subcutaneous injection and a 23 gauge syringe for intramuscular injections. I also have an aspirating needle, which is used to draw the medication from the vial, and we have sterile water, which will serve as the medication used in this demonstration. I also have cotton balls. One is soaked in 70% of alcohol, and the other one is just dry cotton balls. I have a hypodermic tray and forceps, and most importantly, I have waste receptacles here. This is where I will dispose the used needles and syringes so as to avoid needle prick injuries. So, to prepare the medication in an intradermal injection, first we need to get the tuberculin syringe, open the sterile package. Always remember that we can only touch the barrel and the plunger of the syringe to avoid contaminating the needle. If the syringe is cut, then remove the cap first, because we'll have to connect the syringe of the tuberculin into the aspirating needle. Okay, so we'll also have to open the package of the vial access device or the aspirating needle. And then connect the barrel of the tuberculin syringe to the aspirating needle. Secure and ensure that the connection isn't loose. Okay, set it aside first, and then open the medication vial. Now that the rubber seal of the vial is exposed, clean the surface of the rubber seal using a cotton ball soaked in a 70% alcohol, and do this for at least 30 seconds. Now take the syringe, uncup the syringe, and then draw some air inside the syringe. Okay, the volume of air that is needed to be drawn inside this syringe is equal to the amount of medication as ordered by the doctor. After that, inject the air into the vial. Invert the vial and draw the exact amount of medication needed. Now, if there is an air bubble trapped inside the syringe, we can tap the barrel. Okay. And now we'll have to remove this aspirating needle. And replace it with the right size needle that will be used for the actual administration of the medication. Now discard the aspirating needle used into the waste receptacle to avoid needle prick injury. Also, do not forget to write the medication ticket, the name of the drug, the dosage, so that we won't forget what medication was drawn into that syringe and we won't get confused. First, check the medication order on the patient's chart, which is much more reliable than the medication ticket. Now, introduce self to the patient, verify patient's identity, and explain the procedure that I'm about to do. So, good morning, sir. How are you doing today?
Fine.
And I am Shikaina Maranga, your student nurse for today. May I see your wristband, sir? Please state your complete name.
Edward Fernandez.
And your birth date, please?
July 25, 1998.
Thank you, sir. So today, your doctor, Dr. Melendez, has ordered for a penicillin skin test, which means I'll have to inject just a small amount of penicillin into your skin to check if you are allergic or not with the penicillin medication. Will that be alright?
That's fine.
Okay, sir. Perform hand hygiene and observe appropriate infection prevention procedures. Now, arrange the medication card on a hypodermic tray with the corresponding drug. Now, choose an injection site free of lesion or discoloration. Select the site 3 to 4 finger widths below the antecubital space and 1 hand above the wrist. Position the client's arm so that his elbow and forearm is supported in a flat surface, and then apply clean gloves. Now use an antiseptic swab to clean the site, beginning at the center, circling outward about 5 centimeters. Now remove the cap and hold the syringe between the thumb and the forefinger with the bevel of the needle pointing up. Stretch the skin taut by gently pulling with the thumb and the forefinger of the non-dominant hand. Okay, pull the needle very close to the patient's skin. Insert slowly at a 5 to 15 degree angle until resistance is felt. Advance the needle up to the epidermis 3 millimeters and slowly inject the medication until you see a bleb resembling a mosquito bite appear on the patient's skin. If a wheal appears, it means that all solution are in the intradermal tissue. Now withdraw the needle the same angle it was inserted to minimize tissue damage and discomfort for patient. Pat dry cotton ball and do not massage the area. Now encircle the bleb with a blue or black pen and instruct the patient not to rub the wheal or erase the mark. A red pen may influence the reading, and massaging the area may interfere with the test results by spreading the medication to the subcutaneous tissue. Okay, sir, so now we're done with your skin test, but we still have to wait for a few minutes to have the results, okay? So, I'm gonna have to leave you here first so that you can have some rest, okay? And please do not massage the area where I did the injection, and please do not remove or erase the mark, okay?
Okay.
Okay, so I'm gonna have to leave you now. Thank you very much for your cooperation, and I'll be back after a few minutes, okay? Assist the patient in a comfortable position and indicate at the back of the medicine card the site and due time of reading, which will serve as a reminder for the nurse on the procedure done. Now don't recap the used needle and dispose it at the waste receptacle to avoid needle prick injury. Wash hands and document the procedure and interpret the result after 30 minutes. The next procedure is subcutaneous injection. Subcutaneous injection is the introduction of a small amount of solution by means of syringe and needle into the adipose tissue beneath the skin. In doing so, we'll just have to repeat the first steps done in the intradermal injection. First, we'll have to read the doctor's order and compare the medication on hand. It is the same. Then perform hand hygiene to avoid infection and cross-contamination. After that, we'll also have to prepare the medication and the equipments needed for a subcutaneous injection. Now, to prepare medication for the subcutaneous injection, we'll need to have an insulin syringe. We need to open the sterile cap, take out the syringe, uncap the syringe. Now draw air into the syringe, just like what we did with the intradermal injection, and draw air just with the exact amount of the medication prescribed by the doctor. Okay, and then inject the air into the vial, invert the vial, and draw the medication up to the exact amount needed. Now there's no air bubbles, so we can just cap it and place it on a hypodermic tray, and then write the drug name and dosage into the medication ticket. Place it also in the hypodermic tray. Check the doctor's order and the patient's chart. Introduce self to the patient, verify patient's identity, and explain the procedure to the patient. So, good morning, sir. I am Shikaina Maranga, your student nurse for today. And may I see your wristband, sir? Please state your complete name.
Edward Fernandez.
And your birthday, please.
July 25, 1996.
Okay, so, sir, today I'll be doing a subcutaneous injection. I'll have to inject insulin in this part of your abdomen. Okay, insulin is to control your blood sugar since you have a type 1 diabetes. Will that be alright?
Yes.
Okay, thank you. Perform hand hygiene and observe appropriate infection prevention procedures. Arrange the medication card on a hypodermic tray with the corresponding drug. Now determine which site will be used and expose the potential injection site. Now inspect the area for any bruising, inflammation, or edema. Best site could be the outer aspect of the upper arm, the abdomen, just below the costal margin to the iliac crest, and the anterior aspect of the upper thigh. Palpate the site and avoid any area that is tender. Sir, are you feeling pain in your abdomen?
No.
Okay, and to make sure that you have the right size of the needle, use the thumb and forefinger of the hand to grasp a skin fold of the tissue and measure the fold from top to bottom to ensure that the needle is half as long. Okay, now place the patient in a comfortable position. Sir, can you please relax your abdomen? Now apply clean gloves. Now use an antiseptic swab to clean the site in a circular motion, starting at the center, circling outward. Now pull the needle cap and hold the syringe between the thumb and the forefinger of your dominant hand as if you're holding a dart. Insert the needle quickly and firmly at a 45 to 90 degree angle. Pain is minimized by inserting the needle without hesitation. Release the pinched skin and rest the non-dominant hand on the patient. Move the dominant hand on the end of the plunger and slowly inject the medication over several seconds. Retain the grasp on the syringe to keep it still. Now quickly withdraw the needle. Place a swab or gauze on the site and apply gentle pressure, but don't massage the area. Now place the patient in a comfortable position and document the procedure. The last procedure is the intramuscular injection. Intramuscular injection is the introduction of medication deep into the muscle tissue where a large network of blood vessels can absorb it readily and quickly. Preparation of intramuscular injection medication. So the doctor has ordered 5 milligrams of morphine sulfate to address the pain of a patient sustained from a recent car accident which has caused him severe pain and injury at his right arm. So before we could actually draw the medication from this vial, we first need to do the mathematical calculation of the exact dosage needed. So the doctor has ordered for a 5 milligrams of morphine sulfate. It should be divided with the stock on hand, which is 5 milligrams per 1 ml. Okay, so desired dosage divided by the stock on hand multiplied by the quantity. So it would be 5 milligrams divided by 5 milligrams multiplied by 1 milliliters. And the answer is 1 milliliters. Okay, so now that we have the exact dosage needed, we can now draw the medication from this medication vial. Of course, we'll need to have a syringe with a gauge 23 needle. You can now open the sterile pack. Always remember to only touch the barrel and the plunger of the syringe, and then since my syringe is readily connected to the needle, I'll have to It's separated first so that I can connect the syringe into an aspirating needle to draw the medication. Okay. Now connect the syringe into the aspirating needle. Be sure that the connection isn't loose to avoid injuries. Place it there, and then now we can open the medication vial. Okay. Now that the rubber seal is exposed, we should clean its surface with a cotton that has been soaked in a 70% alcohol. Do this for at least 30 seconds. Okay. And then take the syringe, uncap the syringe. Now draw air into the syringe. The air to be drawn inside would be equal to the amount of the medication needed as prescribed by the doctor. And now inject the air into the vial. Invert the vial and draw the exact medication needed. So it would be 1 ml or 1 milliliter. And there is no air bubble. Now what we need to do next is to remove this aspirating needle and replace it with a gauge 23 needle that will be used in the actual administration of this intramuscular injection. Now place this syringe into the hypodermic tray. Write in the medication ticket the name of the drug and dosage, of course. Now place the medication ticket also in the hypodermic tray and discard the used aspirating needle into the waste receptacle in order to avoid needle prick injuries. Check the doctor's order on the patient's chart. Now introduce self to the patient, verify patient's identity, and of course explain the procedure to the patient. Sir, I am Shikaina Aquino Maranga, your student nurse today. And may I see your wristband, sir? Please state your complete name. And your birth date, please. Okay, sir. So your doctor, Dr. Melendez, has prescribed you with morphine sulfate to alleviate your feeling of pain. Okay? Okay, sir. Select appropriate site for injection. Vastus lateralis and deltoid muscle are possible site for intramuscular injection. Examine the integrity and amount of patient's muscle mass and palpate the muscle area. If there is tenderness, then this site might not be suitable to be an injection site. Inspect the area for bruising, inflammation, and edema. If the skin shows bruises or inflammation, use other sites. Now help the patient find the comfortable position that will accommodate the injection site you've chosen and expose only the portion of the body. So my patient is in a side-lying position. Now apply gloves and use anatomic landmarks to find the site again. For ventrogluteal injection, place the heel of the hand over the greater trochanter of the patient's hip with the wrist almost perpendicular to the femur. Point the thumb towards the patient's groin. Point the index finger to the anterior superior iliac spine and extend the middle finger back along the iliac crest toward the buttocks. The index finger, middle finger, and the iliac crest form a V-shaped triangle. The injection site is the center of the triangle. Disinfect the injection site in a circular pattern from inner to outer for about 2 inches. Hold the gauze pad between the third and fourth finger of the non-dominant hand and then uncap the syringe and hold the syringe between the thumb and forefinger of the dominant hand as if holding a dart. Place your ulnar side of your non-dominant hand just below of the injection site and pull the patient's skin laterally about 1 to 1.5 inches. Hold the position until you inserted the needle. Aspirate the syringe by pulling back the plunger with your dominant hand. This is to determine if you have hit a blood vessel. If blood appears, then it means that you have hit a blood vessel. And then remove and discard the needle and syringe and start over. Inject the medication slowly at the rate of 1 ml at 10 seconds and wait 10 seconds and smoothly withdraw the needle. Okay. Release the skin and place a gauze or swab over the injection site. Apply gentle pressure but do not massage the area. Place the patient in a comfortable position and then document the procedure. Sir, we're done with the intramuscular injection and I'm going to head out now so that you can have some rest here, okay? Just please avoid massaging the area that I have injected with the medicine, okay?
Okay.
Thank you for your cooperation, sir.